Now, a big focus of immunology is just understanding terminology. We'll go over some of it right now. And the basics of your immune system, as well as some labs and lab values. And we may start just going over immunizations today, so like vaccinations and immunizations. Now the things we're going to learn about immunizations and vaccines is basically like their dosing, like how their dosing should be administered, contraindications, like reasons why people wouldn't get it, things to be wary of, like their allergies, so certain people with allergies shouldn't get certain vaccinations, things like that. Okay? Alrighty. So, let's begin reading. Chapter 76. Wait. First of all, starts off with diagnostic procedures for immune and infectious disorders involve identification of pathogenic microorganisms. The most accurate and definitive way to identify microorganisms and cell characteristics is by examining blood, body fluids, and tissue samples under a microscope. Effective treatment of infectious disease begins with identification of the pathogenic microorganism. Now, first off, you have white blood cells, or leukocytes. These will stimulate the inflammatory response and offer protection against various types of infection and foreign antigens. There are five types of white blood cells. Neutrophils, right? Lymphocytes, monocytes, eosinophils, and basophils. Circulating WBCs is a differential which lists percentages of the types of WBCs for a total of 100. The percentages represent the proportion of each type of cell in the sample of WBCs. If the percentage of one type of a cell increases, the percentages of other types will decrease accordingly. Now we have a few terms, but the expected range for WBCs is 5 to 10,000 WBCs. And for short, right, we can do 5 to 10,000. Okay, come on. Now, you need to be familiar with these terms. Leukopenia is white blood cells less than 4,000. Menos de 4K. What song? And if you haven't heard it, don't bother. Garbage music. She meant it too. She said it was hard. All right, sorry, I messed that up. Leukocytosis is a total WBC count greater than 10,000. Okay. Now, let's read through those and then we understand this is the basic meaning of these words, right? Leukopenia. Penia, have you noticed? Thrombocytopenia, leukopenia, pancytopenia, penia, this suffix, the suffix is means low, right? A low quantity in the blood is what it translates to. So leuco is white, right? So low white blood cell count. While osis usually means a condition of, and it can most frequently be used for when there's an excess amount of something, like a condition of, is what osis means. Just like itis means inflammation. So, with leukopenia, it can indicate a few things: drug toxicity, autoimmune disease, bone marrow failure, and some overwhelming infections when your immune system is so depleted. However, leukocytosis can indicate inflammation, infection, some malignancies, trauma, dehydration, stress, steroids, thyroid storm. Okay, all the cells activate, can be present during inflammation. So, common ones you should know for this one though are infection, trauma, are common raisers. Stress can too. But infection is the number one. Now all this can usually be some effective drugs, whether recreational or prescription, bone marrow failure, and that bone marrow failure more extensively, right, can be also due to like cancer. Okay. Now, if you read continuing at the bottom left of page 597, under leukocytosis, there's 2 bullet points. Look at the first bullet point. A client who has had a splenectomy can have a persistently increased WBC count. A splenectomy is when they remove the spleen. Although older adult clients can have severe bacterial infections without leukocytosis, manifestations of infections such as fever can be absent in an older adult with an infection. The nurse should monitor older adult clients carefully for infection. Okay. Now, splenectomy causes this because your spleen is like a little reservoir, a little storage, right? For white blood cells and blood. A little pouch for you, you know? So if they remove it, you don't have that place where they're all big chilling. They're just constantly floating around now. So without the storage for them to just be, they're consistently circulating.
So would they be shift to the left,
No.
WBC, or just like, because you don't have an infection, you just don't have spleen.
Right. Well, we're going to go over a shift to the left is
Disconnect the meeting.
Screen.
Screen.
So, neutropenia.
Screen.
Neutropenia is a neutrophil count, so specifically neutrophils, less than 2,000. Those guys. Neutropenia occurs in clients who have viral infections, overwhelming bacterial infections, or undergoing radiation and chemo. It is a more common thing you should know about. And that they then become at high risk for infection. people who have a low neutrophil count. Now, radiation and chemotherapy does not equate this. Maybe I should write this here. So this is the cause, right? This can cause it. It's one of the causes. But a key thing to know about them is for neutropenia, high risk of infection, regardless of the cause. Does that make sense to everybody? So don't, right, like a lot of people are like, well, radiation and chemo people are at risk for infection. That is a true statement. But the more accurate one is people with neutropenia are at risk for infection, which can be caused by chemotherapy or radiation, but as well as other things. Certain types of infections can also decrease it. Okay? Now, first bullet point, the absolute neutrophil count of a client who has neutropenia can help determine the severity of the client's risk for infection. Multiplying the total WBC times by the percentage, plus the percentage of bands determines the ANC. In ANC less than 1,000, neutropenic precautions are essential. This is more commonly known as so if your absolute neutrophil count goes below 1,000, you are now at such a severe risk of infection, you will have neutropenic precautions. It is one reason why you would go into reverse isolation. It is, right, like reverse isolation can be done for several things, several immunosuppressants, neutropenia being one of them. So reverse isolation is just a very broad, a big term to say, right? Like, we are gowning up and we're doing precautions to protect the patient from us. But to do reverse precautions, there are several reasons. Neutropenia is one of them. Don't confuse the two, like someone's on reverse isolation and you're like, for sure they have neutropenia, like guaranteed. Again, true understanding of the terms. Okay, now neutropenic precautions, a protective environment, include the following. You need to know these, and this will continue to be emphasized like over and over and over and over and over again in all these chapters. Every single damn disease and medication that suppresses you, it goes over the same things and do these same things, okay, same actions. Restrict visitors. Especially those with infections. Restrict exposure, or say no exposure to live, whether they're cut or potted plants, not just flowers. All fruits and vegetables are well washed, is now the standard, but preferably it should say that it is cooked.
So for your test, would it be cooked or washed?
I don't put this question no more, it's too easy. No, it's essential fundamentals for infection control. Avoid contamination from the OWN's bacterial flora by avoiding the measurements of rectal temperature and eye injections. So be wary even of your own flora. You have bacteria living all over your body, inside and out. So hand hygiene. And then no rectal temperature. Yeah, no fresh fruits and vegetables, and if you do have some, make sure you wash them very well. The concepts are very similar to like infection control. Yeah, you have to read it, no, there will be many involved with disorders. For rheumatoid arthritis, HIV and AIDS, SLE, lupus, gout, they all come with their specific, certain meds that are very specific to them. We go over them. And they apply. One of the commonly, the mark. Okay, we wrote this down. This is common. We'll go over more, okay? But these are like good general expectations of someone on neutropenic precautions. Now, we do have something called the left shift, or a shift to the left. Like Beyonce. Is that who sings that? No.
Yeah.
Left to the left. No. What do you guys live under a rock? I'm like the least one kept under with like things of today, but I know that one. Alright. Now, this term is used to describe an increase in immature neutrophils, which immature neutrophils are referred to as BADs or stabs. Stabs. Okay, so increase in immature neutrophils, BADs or stabs, that occurs with acute infection. So let's explain a little bit about that. Neutrophils production increases allowing these immature cells that are not capable of phagocytosis. Now, phagocytosis, you can think of, it says right there, ingesting and destroying bacteria. It's a process like your neutrophils can engulf bacteria or other antigens and they break it down. But if you release immature cells, they are not able to do these. These immature cells are known as stabs or bands. Mature cells, which we'll learn, I think, on the next thing, the mature cells, mature neutrophils, are referred to as the fact that they are segmented, or segmented cells. And bands or stabs are immature. So what happens essentially is when you get an infection, like very acutely, your body's immune system responds and you start releasing all these cells, right? These white blood cells, these neutrophils, but then as well as what you're releasing is immature ones. It's like, imagine like, if we're at war, and so we obviously have, right, like countries have soldiers that are trained and ready, but then you need more because we're at war. You start grabbing these people right here, and you can, you know, do dosage count, and they're sending them off over there, and just like, see what you do with that, you know? Just figure it out. You get what I mean? You find out how to kill people if you can't, results of 15.3. Can you imagine how scary that was back in the day? Like waking up, like on May 15th, where you gotta look for your name and see if you're gonna leave? Must have sucked. We get drafted?
You want coming back, right? Didn't you press that bell where, they're now gonna be driving me and the 26.
Moving on? Alright. Neutrophils.
Except for one. The rest.
Percentage number. Alright, T cells and B cells, these are your lymphocytes. And these are 20 to 40%. Okay? Now T cells, I should write it like this. We're gonna learn about this, where this is cell-mediated immunity and cell-mediated immunity, and B cells are humoral immunity. Humoral. The what?
Oh, I think that's T. The humoral one?
The
Okay.
monocytes,
CD40.
2 to 8%. Eosinophils, 1 to 4%, and basophils, 0.5 to 1%. Oh, sorry, yeah, to 1%. Okay, this is usually due to allergies, will increase it. Increase with decrease. Sorry, it's the opposite. infection with allergy. I just put it into scrubbing. Okay. It can be, it depends on which of the T cell and like its specificity to it. Because they don't only attack viruses, but it's the one that we see in a lot of viral infections, because viruses require more specific like deterioration. Okay, so neutrophils, lymphocytes, monocytes will respond to infection with a bacterial, and in certain cases, lymphocytes are more effective towards viral. Okay, neutrophils are like a very generalized, just going around killing stuff. Okay, now T cells and B cells are more specialized. B cells, when they say they produce humoral immunity, and the T cells with their cell-mediated. So, can I switch this? It's a response, like what they're useful for. So for allergic reactions, parasitics, and infection. And then we'll talk a little bit more about T cells and B cells. Yes? All right. So in the B cells that provide humoral immunity, and what this means essentially is they produce antibodies. Now, antibodies, you can think of like what you refer to as antibiotics. Now, you take antibiotics because they're synthetic, right, and very specialized to destroying the bacteria that is in your body. Your body can also do that. Of course, it just does it at a slower pace, or in some cases, our bodies are not as geared to fight it off, and hence the creation of antibiotics has saved so many people from dying from diarrhea. And yeah, people used to just die. Well, for people.
They would just.
So the response that we're having across the room shows the power of antibiotics. Do you worry if you have diarrhea? No. You don't. Before? Go buy a coffin. They might have not known it yet, but they probably were. Okay? Because it dehydrates you really quickly. Make sense? The dehydration, what else are you losing? Electrolytes. You're just about to sure as to die because there's no way to treat it. And probably the water source is where you got the infection to begin with. So your hydration is crap. So now, we usually tend to have cleaner water, and I think people wanna live like in a lab, where like the water is like immaculate, okay? And I don't know about you, but I don't really necessarily like distilled water. And then, like, people back then wouldn't wash their hands, because they didn't know things existed, like germs. Yeah. Hence, somebody put it together, because in a lot of like the poorer countries, what's the common custom to do? For cooking and eating. Yeah. You wipe with your left, and you eat with your right.
That's why the left is the devil.
That's why the left is like it's not supposed to be given or anything like that. So where a lot of that stems from. Obviously, it's not true and it's lost in our culture. But a lot of countries, it's just common that they just don't mix the two. Make sense? It's the one that you commonly wipe with. So this prevents that. Now to today's day, antibiotics will do this. Your body is not sometimes strong enough to fight these infections, but in some of them they are. That's why in some of them the doctors just want you to do what? Just let it run its course. Because your body will develop immunity to it. So, you have T cells as well. Now with T cells, they provide cell-mediated immunity. And you have two types of T cells that are commonly referred to in this class and for this level. CD4, also known as your helper T cells, and CD8, also known as like your suppressor T cells. Okay? Now, each one has its function, but one cannot work effectively with the other. Okay? So, these produce antibodies, and the antibiotics either break down the cells, help being able to eat it, help being able to digest it, or they can weaken it. That's what antibiotics do. If you remember back to your pharmacology class, things like, right here, aminoglycosides, what do? They just break down the cell wall. Break cell wall. And that's why you see that some antibiotics are bacteriostatic, and others are bactericidal. This means that it either stops the production and your body is able to overtake it, or it actually kills the bacteria in order to help manage and treat the infection. So CD4 and CD8s, these stimulate a response, recruit more cells, and these actually help kill a lot of them too. These do it through phagocytosis as well. So you have B cells and T cells. So humoral immunity is called like broad, like understanding this. Okay, humoral produces antibodies, general activating signals towards your body, while T cells actually take care of a lot of the work. Now these B cells, some people refer to, you might have learned in high school, are called also memory cells. And that's because they will remember and hold on to a lot of these antibodies or immunity responses. So the first response to a new infection can be slow. But the second is a lot faster. Because it now remembers the immunity. It now knows what to do to fight it. Make sense? Hence, if you sometimes, and some bacteria or viruses that don't mutate as often, that don't really have like this advancement, once you have immunity, you don't necessarily lose it. You can continue, right? Either for lifetimes or at least decades, you can become immune or maintain immunity. Now, these factors can also depend on just your immune system. Over time, your immune system depletes. So So it's not uncommon that you might lose immunity, hence the invention of, or people take, booster shots. Right, we all got your Tdap, but if you step on a rusty nail, if you haven't had one in the last 10 years, they'll just give you another one, so you don't lose a foot or die. Yes? So do we understand B cells and T cells? Okay.
Wait, so what's the suppressor?
Huh?
What was the suppressor, the CD8?
They help send signals and or can suppress the antigen. These, the helpers, even though they're called helpers, they actually will phagocytose.
Thank you.
Okay? You understand? Now, this is the one that stands out for HIV. Because it's the one, it's the specific type of cell that HIV uses to reproduce. So it starts depleting it. And it's essential for your immune system. Hence, you can't work just with the rest of your immune system. You need every part plays its role. So even though HIV mainly and only attacks the CD4, it takes its toll on your immune system. We'll go over HIV in 200.
He's like, yeah,
If your CD4 count drops below 200, that's like diagnosis. I didn't know this. I saw like this immunologist that I follow, and she threw like a little joke out. Because just a couple of days ago or something, like I saw a post, I started seeing people post about AIDS Awareness Day. And she's like, she posted like the thing, the flyer thing, and then put, I guess except for Joe Rogan and John something, like another dude, something junior.
What's wrong with Joe?
He's an idiot to begin with, but there's that. But I guess he, now this is important because to this day, I'll get a report from people and they're still like, watch out, he has HIV.
Oh, it's all that.
And I was like, got it. Now let's talk about the stroke, because this was like,
I know there's nurses that refuse seeing.
they refuse seeing them, yeah. But anyway, I'll tell you what I'm scared of. Scabies. Because, okay, my skin is dry as hell because I don't like putting lotion. Because I don't like feeling wet. Okay? I like feeling dry.
But you
Like
don't
it's
like
moist.
that.
Like if you lotion up right after the shower, you're moist. I'm like, I'm looking for moist.
I feel weird.
I don't feel
Oh, I see that on TikTok.
I used it on my daughter when she got lice in the summer. I'm gonna get it, like, in the shower.
Yeah,
And then put on her and then I brushed her hair out, and I was like,
that's wild.
and then I went to a hair party somewhere.
What time is it?
It's like 6 to the, yeah.
Thanks for getting my eyebrows. So they're not giving good.
Thank you.
He's here already.
Are you still in the same chapter?
Alright, quiet down. So this is not in your ATI, but you need to learn it. So you'll have also what's known as innate or natural immunity. This is something that it's also very like broad, like it's just a general immunity. It's not specific to any bacteria, virus, or nothing, but these things just protect you for the most part. Now, can some bacteria or things pass this? Sure, because they're made for it, right? But generally, these things protect you from most infections. Now, you don't generally see this because it's, again, you're unconscious to it, you just do. But your skin, for example, protects you from bacteria. That's right, like that's why when you get a cut, that's when you're more prone to be able to get an infection because your skin is now no longer covering you and there's an opening for bacterial or antigens to get in. The intestines and vagina are, you know, secretions and flora and acidity, things like that will not allow a certain bacteria or antigens to flourish and therefore you don't get an infection. Your stomach acidity, when you eat certain things, yeah, some stuff might be a little this or that or have something on it, but the acidity will probably just kill it all to begin with. What else? Your tears, right? Dust or stuff gets in your eye, right? Your cilia, like little hairs, your eyelashes, inside your nose you have nose hairs. All of these things stop you from things traveling into your respiratory tract and getting in your eyes. Have you ever got something in your eye? What happens? All these tears started, like it tries to flush it out. Okay? So there's that. And then you have adaptive or acquired immunity.
That's like getting sick.
Partially. Now, this, let's go over to the next page.
What about community? Like, what is it called? That's like.
Community acquired pneumonia, that's not.
No, not the one where it's like you might not be vaccinated, but people around you are.
Herd immunity. So, you have different types of acquired immunity. So you have, first of all, you have active. And then you have passive. Actually, yeah, I guess we'll do it like this. And then you have active, you have natural, and artificial. Then you have passive, that's natural, and passive, that's artificial. So these are 4 kinds of immunity. You can add immunity at the end of that, right? Active natural immunity, active artificial immunity, passive natural immunity, passive artificial. You can also write this the different way, right? Where you can just do natural, and then you have active and passive, or you can do right then artificial, and you have both active and passive. So there's 4 kinds, and you can separate it however it's easier for you. Either remember that there is 2 types of passive, or 2 types of active, or 2 types of natural or artificial. However you want to organize your chart. I like this form better. I'm going to delete the other one. Okay? Alright, let's be back at 12 and we'll